Alrighty, welcome back to the Dental Debrief. My name's Maheer, this is my best mate, Dr. Tim. We're here to talk about the nuts and bolts of dentistry, and we practice out of Azure Dental in Perth, Inglewood. So do you feel dental anxiety? A lot of our patients do. So this episode is completely about anxiety and all the options, everything that we have to really reduce your anxiety. So Tim, where do you think all the dental anxiety is coming from?
I think bad experiences in the past. Once you have one bad experience at the dentist, that just sets up pathways in your brain, so you're always gonna be scared of the dentist in the future. In the past, dentists just didn't put enough effort into making the experience comfortable. The important thing when a patient comes in is that they feel comfortable to get treatment done, because if you're scared of the dentist, it's always going to be really terrifying if you have a problem that comes up. So Maheer, where do you think all this dental anxiety that we see is coming from?
I think, like you mentioned, it just comes from old school mentality, old school where you'd go to a specialist or someone, a professional, and they just tell you and whatever, and then you always just blindly follow that. So we never felt in control, and our patients would never have felt in control, and especially from really young. I find my bad experiences happened when I was at school as well. So I think if we can set up our really young patients with like a handful of awesome experiences at the start, we can hopefully bring that anxiety down.
Exactly. I think we've talked about this before, that we've put everything into this clinic. You know, our entire livelihood is this clinic. We've spent a decade plus working towards this. You know, we've put all of our finances into this clinic. All that matters is the success of this clinic, and the success of this clinic is dependent on people having a good experience. What keeps me up at night is the idea of a patient coming here and having a bad experience. It's terrifying, you know. I just want everyone to come through the doors and leave and say that's the best dental experience I've ever had.
Totally. Do you recommend sedation for your anxious patients?
So I do a lot of sedation, okay? But that doesn't mean that it's my first line of defense for anxious patients. I think it should be the last option. Sedation is powerful, obviously. If you go to sleep, and we can do that with a medical anaesthetist, we can get everything done. The problem is that you never learn to be comfortable in the dental chair. So I think sedation is good for bigger procedures. If there's a lot that needs to be done and there's just no way that you're going to be able to sit in the chair for 4 or 5 hours, then beautiful, sedation's there. But at some point, we need to start getting people comfortable to getting treatments in the chair, because sedation has risks. It's expensive as well. So the other option that we use a lot of is the oral sedation, where we prescribe a mild sedative to take an hour before the appointment. We don't charge anything for that because we just want people to be comfortable. Oral sedation just takes the edge off. Again, I don't think it should be used on everyone. Again, there's risks involved, and you really need to choose your patients for it. But there are some really powerful options that we've got available if someone really can't sit in a chair. For patients with dental anxiety, do you recommend sedation?
I recommend sedation almost more for long procedures now, where someone's gonna have to have their mouth open for like 2-3 hours. I would more likely use it for that. But I'm finding less and less with my normal day-to-day, like bread and butter dentistry, anything that's like less than 2 hours, we can get away without it. And we use like lots of different techniques. Obviously we've got TVs everywhere, we've got awesome music, the clinic's really wide and open, we don't have like scary overhead lights, but we also use like the rubber dam sheet. So our patients just often fall asleep and they kind of are sedated without any drugs. And it just comes from making people feel relaxed. And I've focused more on that now, and just taking time, doing procedures slower, having lots of breaks, having time to chat, having time to have a drink. I find once you do that, most of the anxiety goes out the window, and we don't have to prescribe things. So you don't have to have someone pick you up and drop you off and all that other stuff that comes with it. And you're just saving like a lot of time.
Exactly.
And just having good experiences as well.
Maheer, off dentistry for a little bit, is there anything that you do personally to help deal with anxiety and sort of anxious situations?
So I'm probably a naturally anxious person. So 2 things for me. One's been martial arts. That's just like my outlet. Especially as a dentist, we don't get to move our bodies too much. We're kind of like stuck in one position. So the martial arts has been great. And I do a lot of yoga. I like to meditate. I do like breath work and all that kind of stuff. Sometimes we even do a bit of breath work kind of exercises in here just to help calm the nervous system and kind of just center yourself. Those things have been game changers for me. That's helped my career so much by just giving me balance. Yeah. So Tim, outside of dentistry, you do really stressful procedures. How do you manage your anxieties and your stresses?
Yeah, so you're exactly right. I find dentistry stressful. I agonize over my work. I think about it, I obsess over it, and it can be detrimental to your mental health. I sort of see it as that obsessing and that worrying about work. It's sort of a side effect of just caring a lot.
A double-edged sword.
It's a double-edged sword, right? If you care a lot about your work, you're going to agonize over it. You're going to be anxious about it. So to me, it's not something that I want to go away, because I always want to be that person who cares immensely about my work.
Like you dot your I's, you cross your T's, everything's done really well.
Exactly.
Because of your attention to detail.
Exactly, but outside of work, you're absolutely right. It's so important to have balance. For years, I've just put everything into dentistry. I've just been, every aspect of my life revolves around dentistry and learning and studying and working. And over the years, exactly, developing an exercise routine, meditation, all these sort of things are so important to make sure that you've got a healthy mind, because the job's draining. Yeah.
So Tim, have you had any patients that have had really severe dental anxiety?
Loads, absolutely loads. I've had patients who can't even come into the practice because they're so anxious. I think the hardest part for a patient who has dental anxiety is that first visit. Are you going to click with the dentist? Are they going to be a good dentist? Are they going to try and sell you some bullshit? I think people come in really, really anxious for that first appointment. So many patients of mine I've seen have come in with that state, and on that first appointment, they're so nervous. But just by having a chat and taking it really, really slow, there's so many patients that we've had come back, just a different person after that initial consult. Yeah. So Maheer, have there been any Maheer, have you had many patients who've had dental anxiety over the years?
I would say too many to count, to be honest, but it's given me the opportunity to make a really good experience. And now I'm really confident that I can get the most anxious patient in the chair and they're going to leave really happy. And often I'm finding with my anxious patients, it's always much worse in their head. So they come in expecting, oh my God, are you going to tell me I have so many problems? And maybe they have a couple of problems, but we can stage treatment, we can do it efficiently, we can do a big appointment, do lots in one go while they're sedated, for example, or we just break it down into bite-sized pieces. Yeah. And it all gets done. If you give it like a 6-month, 12-month plan, it all gets done. And then you get to a place where you can just come in for your maintenance, and that's easy, that's fun. You kind of just hang out, we have a chat, do a clean, and then you're on your way. So that's the goal for me, for my patients, yeah. So Tim, for our patients, what can a patient do to manage their anxiety before the appointment, during the appointment, and after?
Before the appointment's a big one. I think a good sleep is really, really important. So many patients over the years have come in, before procedures or examinations saying, I just didn't get much sleep last night. If you haven't had much sleep, your anxiety is naturally going to be through the roof. Provided we've seen you before, that's usually something that we can discuss at your first consult. If you have trouble sleeping the night before an appointment, we can prescribe you something so that you do have a better sleep the night before. And that's really important, so you're coming in fresh. If you're coming in fresh after a good sleep, you're going to be calmer, you're going to be happier, and you're going to take the information on better. I think during an appointment, the most important thing is the TV. TV's up on the roof there. I find as soon as we sit patients back and they see that we've got Netflix on the screen up there, people are straight away a lot happier. After the appointment, well, I think after you've left here, the only thing people are usually really stressed about is either the outcome of their treatment or perhaps the cost of treatment. Again, I think it comes down to the discussion at the initial appointment. We go through the costs really, really thoroughly so people know exactly what they're getting into before they go through with anything. So I think anxiety after the appointment isn't a huge issue. It's before and during. Yeah. Any suggestions that you have for patients to help manage their anxiety before, during, and after the procedure?
Yeah, so before, there's a couple of things I've noticed my patients that have made their anxiety worse would be like avoiding stimulants and coffees and things like that before they come in, because those things will fire you up a little bit and they kind of increase the adrenaline inside you. And also like having a good meal before you come, because you feel like starving when you're in here and we've got a long procedure, that anxiety will kick in as well. So just look after yourself, and yeah, if you need a good sleep before, maybe put the appointment at a time where it's going to work well with you and you'll feel a bit less anxious. If you're not a morning person, maybe book it for the afternoon. Yeah. Just feel free to reach out to us during your procedure. So if you aren't having a good experience, let us know. We're very tuned in by we've had so much experience now. So we'll pick up when you're feeling tense, you can see your fingers or the muscles are really tense. That wears you out the worst because you're turning on all your muscles the whole appointment. So if something's not feeling right, you can always stop the procedure. You're in full control. Yeah. And then afterwards is just stay in contact. Something's not feeling right, you're uncertain about something, don't put up with it. Just give us a ring. Our reception team are so friendly. We'll get you in, we'll squeeze you in, we'll see you on your lunch break. Yeah. We don't mind, but we just want you to have a good experience.
That's it. I know whenever I do sort of bigger procedures, surgical procedures, whether it's wisdom teeth, implants, patients always have my mobile number. And I tell them, you text me or call me at any time, because if there's a problem, I want to know about it straight away, just so they're not sitting there stressing about it, waiting for an appointment. But the funny thing is the amount of patients who are hesitant to text, and when I see them 2 weeks later and they say, oh, I had this terrible pain or I had this problem, and I'm like, why didn't you text? And they say, well, I didn't want to disturb you. And it's like, well, this is my life. Like, I'm here to make people's life better.
And we have so many options to reduce your pain. There's so many pain relief medications available. There's a million things we can do.
Yeah, I just want people to contact me straight away if they've got a problem, and I always make sure that they have that ability. So guys, that concludes another episode of the Dental Debrief. If you have any questions at all, comment below or hit us up in our DMs.